And welcome to Ask Your Academic. Today's session will cover the MSc Critical Care, and we're joined by one of our clinical fellows, Calum, who is going to run through any questions you might have about the programme. If you've got any questions that are about funding, accommodation, things like that, I'll post some useful links into the chat box for you. And we've also got our online postgraduate event on Tuesday the 7th of May, and there'll be sort of separate sessions on accommodation and things, so that'd be a really good session to attend. We are recording the session, so don't panic if you need to leave halfway through or that. We will share the recording probably early next week for you to go back and watch anything you've missed. So I think that's everything. Calum, would you like to introduce yourself and tell us a bit about the critical care programme?
Yeah, my name is Calum, one of the doctors who works at the Queen Elizabeth Hospital in critical care. Part of my role is also helping to run the critical care MSc in conjunction with the University of Glasgow. And
Perfect.
then, was that about the course as well? Yeah, sorry. The course, the Critical Care MSc, is primarily an academic course that will hopefully teach students how to analyse and critically appraise evidence and evidence-based medicine. It will give students an understanding of what constitutes as good quality evidence, and hopefully going forward in their careers, they're then able to apply that to kind of their everyday working life and whatever kind of area that they work in, able to kind of apply that and use the kind of good quality evidence for the benefit of patients.
Perfect. And you mentioned you're based at the hospital. Whereabouts does the bulk of the teaching take place?
Yeah, so pretty much all of the teaching happens within the Queen Elizabeth University Hospital in Glasgow. So it is it's certainly the biggest hospital in Scotland, and it's probably quite highly within the UK. So and certainly the critical care department is a 60-bed unit, so it's quite a large critical care unit. So all of our teaching occurs within the critical care unit. Within the Queen Elizabeth site. Some will be within the Teaching and Language Centre, which is adjacent to the building, but most of our lectures and seminars occur in the critical care department.
Great. And do students get any contact with the patients, or is it separate?
So the course is primarily an academic course, so there's not really any kind of patient contact. It depends on the course. Some courses are probably are more kind of clinical based than others that are more research based. So kind of within the clinical courses, there can sometimes be the potential for patient contact, but it just kind of depends on what's going on, the acuity of the patients and what's going on within the unit, and also who's providing the session, whether they want to take students to see patients. I guess just to, as I say, to reiterate, it is mostly an academic course. It's not really a clinical course in that. So most students will come with some element of clinical background already. So it's just really to hone the kind of research skills.
And you just sort of mentioned that there. What kind of background do students typically have? Is it doctors, nurses?
Yes, all of the above. Essentially, the course is kind of open to anyone with a kind of healthcare background. So we currently have a few doctors on the course issue. We have a few doctors, a respiratory therapist, anaesthetic assistant. We've had pharmacists before, nurses, paramedics. So it's open to anyone.
Perfect. Quite a mix then.
Yeah.
I know it's quite a difficult question to answer, but we're always asked, how often should a student expect to be sort of in class each week?
Yeah, like you say, every week's a bit different. Teaching days, where you're physically in the hospital, is a Tuesday and a Thursday. So on Tuesday, it's a full day of teaching, which probably constitutes about maybe 4 or 5 hours of lectures. and then on Thursday it's a half day, so 2 or 3 hours. And then obviously with that time, it's kind of self-directed study. So depending on the courses, most courses on the critical care course are 20 credits. So we say for 10 hours of teaching, there'd be 100 hours of kind of self-directed study. And the self-directed study can be done anywhere.
Perfect. And someone's asked in our chat box about assessments. So can you give us a bit about how a student can expect to be assessed?
Yeah, so each course has 2 summative assessments, so which usually constitutes as one written assessment that usually is about 80% of the grade for that course, and then some other assessment that's usually takes the form of a poster presentation or a review of a paper that's like an oral assessment. So that's how you're formally assessed for each course. There's also within each course we do summative assessments as well. Formative assessments, which mirror the summative assessments. So essentially they're there to just give you a practice of what the final assessment will be like, and they're the same. So there'll be a written part and so if the summative assessment is a oral presentation, a poster presentation, then the formative will also be a poster presentation as well.
Great, thank you. I will say as well that all the courses are linked on the webpage, so if you do want any sort of further information, you'll be able to check the webpage out. In terms of the structure, we were asked beforehand, how does that work for a part-time student?
So for the on campus, it is done as full-time. I don't think, maybe I would need to double check, but I'm pretty sure that it's done as full-time. I don't think we do part-time. Certainly there's no one part-time this year. I would need to double check that within admin team.
Perfect. I think it is on our website, but I think you're right. I think it's very rarely taken up as a part-time programme.
Yeah.
But if there's someone on this webinar that is looking to do it part-time, if you contact the administrator of the programme, they'll be able to give you some sort of further details on that. In terms of class material, do students get access to that before classes take place so they can read over anything?
Yeah, so I guess with the nature of the courses that we do, and just within healthcare and medicine, evidence is updated, continually updated. So every year the courses are updated to make sure that we're teaching about the most kind of up-to-date evidence. So we try and endeavour to get the courses up, the full course up before students start that course. But sometimes what might happen is that you get the first half of lectures. Also, we have a lot of our faculty are all medics and senior staff that are based in the critical care department at Queen Elizabeth, but we also have a lot of guest lecturers as well. So it just depends with their schedule when we can get lectures from them. So sometimes what will happen is students will come in and the first time they see the lecture is when it's been presented to them, but then all the information is uploaded to Moodle, which is the kind of online system afterwards, so they have access to it afterwards.
Perfect. And in terms of the research project, it's such a massive part of an MSc. Can you tell us a bit more about how that works? So how you choose a title, supervisor, and maybe any examples of things people have done in the past?
Yeah, so the year is kind of broken up into three semesters. So the first two semesters, there's 3 courses, and then the last semester is purely dedicated to the dissertation. So our current students, that's what they're working towards just now. Although it's encouraged for students to start thinking about the dissertation pretty much from when they start. The dissertation can take 2 forms. So you can either do which is the most common form is kind of like a literature review of some area of medicine that the student would be particularly interested in, whether that's from the kind of come with that kind of information or something that they're interested in taking their career down that way. The other less common, and certainly there's no one doing it this year actually, is doing some kind of original research. I guess in theory it is possible, but it's quite a short time, and you're only doing the course for a year or two. So to try and come up with a research question, and if you're doing research, you might say, for example, need ethical approval. That can sometimes take time. So our faculty will obviously guide you and provide you as much support as possible, but most people end up doing kind of a more research-based literature review. When it comes to supervisors, if there's a particular area of research that you are interested in, it's probably good to kind of mention that early, and then we can assign a supervisor who also might have an interest or know someone within that area. But essentially, supervisors are kind of, they're all consultants on our faculty, so they're all fairly experts in the field. So most people are kind of just generally assigned a supervisor. Otherwise, if there's not a specific question they want to ask. In regards to kind of what people have done before, as I say, there's a lot of guidance. So even throughout the year before you actually start your dissertation, we have a lot of sessions on kind of coming up with the research question. And there's a lot of kind of, certainly this year, some students have had a question that's either been too broad or too narrow, and they've had a lot of guidance on kind of either honing that or expanding it out. I'm not actually quite sure. I don't know off the top of my head what topics students have done. I know one of our students, he is a anaesthetic assistant, and he's quite interested in kind of the pre-op medicine. So I'm sure he's kind of doing something along that line, kind of research within there.
Great. It sounds like there's a lot of scope though, which is good.
Yeah.
And in terms of preparing for your MSc, is there anything students can be doing between now and starting in September? Any reading or just anything you'd recommend?
So short answer, I'd probably say no. The first course is research and writing skills. So that's kind of a fundamental course because you will use that through the rest of the courses going through. And that course, some students do find it tough to begin with because obviously people come from varying backgrounds. So some people have done literature reviews and critical appraisals before, but quite a lot of our students haven't. So they get a lot of teaching on how to actually do that. And that, I think, so people come from kind of all different areas. So I don't want people to worry and think, oh, I need to read up and to make sure I've caught up, because everyone gets taught the exact same stuff from the beginning. As I say, how to do a critical appraisal. There is lots of guidance on the Glasgow University website for academic resources. You can have a look at that, but essentially, only if you have time. I don't want people to worry that they need to read stuff before they come in September. As I say, you will be taught extensively when you arrive and how to successfully manage the course.
Perfect. I suppose then, if they don't have anything to prepare for it, they can just prepare and getting set up. So if you're moving here, getting accommodation, your bank account, doctors, things like that all sorted, because it's all those little things that take time, isn't it?
Absolutely. And I think our course, so I asked some of our students this year kind of just for some feedback on what they've thought, and they've kind of mentioned, so as I say, I'm a clinical teaching fellow, and there's two of us on the course, and we are there kind of as a bridge between the faculty and the students. All our faculty are really approachable, really nice, but we're obviously just there kind of if we have any kind of odd questions. So we are in contact with our students constantly through Teams, and we're there to kind of help with issues with kind of finding a doctor's. Even like I think on the first day there was a lot of stuff about how to get to Queen Elizabeth, what buses to take, because the transport obviously can be sometimes the transport is not the best to get to Queen Elizabeth. So yeah, there's lots of guidance there, and obviously there'll be new teaching fellows coming in for the September cohort, but they're very happy to help.
Perfect. Google Maps will become your best friend then for getting there.
Absolutely.
Perfect. And then in terms of careers after graduation, what do you find that students going to do? Are they going back to where they were before, or are they sort of progressing?
Yeah, so I think it's really good for your CV, first and foremost. I know certainly a previous student was one of the kind of nurses on the unit and is now one of the charge nurses, so one of the senior nurses, and that she said that the critical care course has definitely helped with that. Certainly our students this year, I asked them kind of this kind of question, like what do they hope to achieve? A couple of them are hoping to go on to do PhDs afterwards, and this kind of course gives a good base on how to do that kind of research and critical appraising. And then others are going to take this information back to their own units and hopefully able to use it just for the benefit of patients.
Perfect. Now we've got a question in the chat box, and you've covered this, but I think it's maybe just worth just asking it again. Someone's asked, will there be opportunities to join the daily multidisciplinary ICU rounds at the hospital?
Yeah, so not routinely, no. The hospital, although you're in the critical care department, the patients and the kind of clinical side of it is separate. So it really depends on the course. There's some courses that are a bit more clinical than others. So within those courses, there might be some opportunity. It very much depends on how busy the unit is and who's providing the session, whether they're wanting to take patients around, take students around to see patients. We do have, and I think we're probably going to introduce some more because we've had some really good feedback this year, particularly, so one of the modules is sepsis, and we ran a sim day with our students, and it was really good. It was received really well. So kind of in the background, we're kind of discussing adding in some more kind of simulation days. So obviously it's not with real patients, but it's just to kind of get them used to, so they'll spend a lot of time looking at research, particularly in the sepsis module, looking at the research, looking at the new guidelines on treatment of sepsis. So it's quite nice to apply that knowledge and the simulation to treat the patients, but primarily it's an academic course. It's not a practical clinical course.
Perfect, thank you. Well, that is all the questions that we've had submitted before the session as well as during the session. So we do have a couple of minutes. So if anybody watching has anything, please do post that in. Just to say again, like Calum mentioned, if you do have any questions about anything else that we've not touched upon or that you need more information on what's been discussed, do get in touch with the administration teams because they are brilliant and they'll get back to you with that. And like I said, that online postgraduate event is on Tuesday. For anything that you need questions answered about anything other than the programme. So yeah, I think that's us. That was a really good overview, some extra stuff. Someone's asking here about time off. Is there a summer or a spring break? So how does that sort of semester work? Is there sort of some time off at Christmas and is it Easter?
Yeah, so there's a kind of natural breaks. So most of the courses kind of run one into the other. So you'll finish 1 week and then the next week you'll start a course, but there is a break at Christmas and there is a break between the second semester and the third semester where you do your dissertation. Time, so if for whatever reason you need some time off, certainly discuss it early with the faculty. They will accommodate as much as possible. Although all our lectures do go onto the Moodle system, so they are online, you can't see them afterwards. It's preferred that you're in for the teaching on the teaching days. But obviously, you know, things come up in life. So if you're needing some time off for whatever reason, just let us know and we'll try and accommodate as much as possible.
Perfect. Thank you. And that's probably a nice place to wrap up. So thanks, Calum, for your time today. I know that you're very busy. And thanks to all that have joined the webinar and that are watching it back. And yeah, we hope to see you all in September. So thank you. Bye-bye.
Thanks.